Hello, everyone. I'm Tom Blevins, endocrinologist at Texas Diabetes and Endocrinology in Austin, Texas. What I want to talk to you about is prediabetes. And, it implies that it's before diabetes, and that would be, you're right if you notice that. And we're going to talk about how to diagnose it, what you should be concerned about if you have it, what you should be concerned about if you might have it, and then we're going to talk about maybe a little bit of treatment to try to prevent, pre means before, and how do you prevent diabetes? If you have prediabetes, we're going to talk about that a little bit too. So let me move right along, and we're going to talk a little bit about defining. Blood sugar levels in prediabetes are high, but they're not in the diabetes range. And they're also not normal, as you might imagine. And also, it's very clear that people can progress to have diabetes who have prediabetes, and that's where really a lot of this information goes. How do you prevent? And prediabetes is some of the long-term damage that we might see in diabetes might already be starting. And people with prediabetes already have, for example, heart disease risk, because many times they have high blood pressure, cholesterol problems, triglyceride problems, and things like that. In the US, is prediabetes a problem? Is it very common? Oh, yeah. About 1/3 of Americans have prediabetes. These are adults. And by the way, we're seeing it in kids too, this type 2 diabetes predisposition, especially with obesity. Many people are unaware they have it, so you can't do anything about it if you don't know. So it's important to get tested. And about 1 in 10, as you know, of Americans have diabetes. Actually, it's more like 13% actually have diabetes. And we'd like to keep that number down and reduce it if we could. Unfortunately, about 50% of people with prediabetes go on to have diabetes over 10 years. And so how do we reduce the rate of progression to diabetes? Well, we're going to talk about that in a minute. But first, I want to make a very important point, and that is, what are the symptoms of prediabetes? I mean, are you going to be symptomatic? And that's going to tell you need to get tested. And the answer is no. There are no symptoms whatsoever. If you have symptoms from high blood sugar, that usually means you have diabetes, like blurred vision, frequent urination. So the only way to diagnose this is to get tested. Now, I want to make a point about mechanism. People say, why do people get prediabetes? Well, one reason is genetics, and some people just have the predisposition. The way your body controls your blood sugar is it makes insulin from the cells in the pancreas, the beta cells, and that insulin has to work. It has to work. And if it doesn't work, we call the situation insulin resistance. So if it doesn't work well, people have insulin resistance. So you have to have insulin production. You have to have sensitivity to insulin. It has to work. So insulin resistance is very common. It's very common in people who are overweight. And it does run in families. And that's a condition when the muscles, fat, liver cells don't respond adequately to insulin. And that causes the sugar to be high. And so, of course, that can be caused by weight and activity. Low activity can make the insulin sensitivity less. And that already tells you what you can do to treat this problem or prevent progression to diabetes. So lifestyle is very important when it comes to treating prediabetes to prevent diabetes, and also medications might be used. What are the risk factors so if you ask yourself, do I have prediabetes? Should I get tested? The answer is, I'm just going to tell you the answer is yes. But if you have overweight, family history of diabetes or prediabetes, history of gestational diabetes, history of polycystic ovarian disease, sedentary lifestyle, oh yeah, get tested. What about high carb diet? Yeah, you better get tested, because that your risk of prediabetes is higher. As people get older, the risk goes up. Sleep disturbances like sleep apnea. People who are African American, Hispanic, Latino have a higher risk of diabetes and prediabetes, and smokers seem to have a higher risk too. And I'll just say, what are the complications of prediabetes? Well, you could go on to have diabetes. Enough said, and we're trying to kind of prevent that. Now, we've talked about who's at risk. Let's talk about actually making the diagnosis. How do you do it? I kind of already told you. Well, first of all, you have to have the inclination to go get tested. It's really easy. Go get a fasting blood sugar. And if the fasting sugar is above normal, but not in the diabetes range, I have the numbers here, 100, 125, then you have prediabetes. That's the bottom line. we do this test called the A1C, the 3-month average. And if it's 5.7 to 6.4, that's prediabetes. It's not diabetes, but it's prediabetes. And we can even do a glucose tolerance test, which I really don't recommend. You can do it. I mean, they're very, very helpful and accurate, but they're kind of busy. So how do you prevent diabetes if you have prediabetes? You've already heard me say it, diet. Even 5 to 10% of body weight loss will reduce the risk considerably. And we have studies to back that up. Exercise makes the muscle work better, increases insulin sensitivity. So if you want to make your insulin resistance less, exercise. Walking is what you need to do. My usual recommendation is walk about 150 minutes per week. And actually the guidelines say the same thing. And, always control the risk factors you might have, like for heart, like blood pressure, cholesterol, stop smoking. We talked about weight. Medications, we do use sometimes a medicine called metformin, which can reduce the rate of progression to diabetes. Talk to your doctor, your provider, person about that. And there are really no supplements that clearly prevent diabetes. And I could go on and on about that, but I can't say that there may be some evidence about vitamin D, magnesium, even some hints with curcumin, but chromium didn't prove out, fenugreek didn't prove out. It's just not reliable. And then, those are things you get over the counter. You don't really sometimes know what you're getting. But anyway, it's always an interesting conversation, and talk to your doctor about that. So when you see the doctor, again, there are no symptoms. So don't wait till symptoms happen. You'll have diabetes, and go get tested. If you have risk, go get tested. When you get blood done, ask to be tested for prediabetes. And it's really important. What should you do to prepare for your visit finally? Well, you might ask if there are any restrictions for you, because you might get tested. The bottom line is there really aren't dietary restrictions. If somebody's going to do a glucose tolerance, you drink the stuff, then just be sure and eat normally the day before. Some people eat less, and it actually makes the test look worse. You want to go in and say, how can I prevent diabetes, especially if you're known to have prediabetes? You do want to ask about what foods to avoid, how much should you exercise. You want to go through the fundamentals with your doctor. And should you see a dietitian? The answer is always yes, really. Personal trainers, that's your choice. And also, when you go in, list your current medicines, list your current supplements too. Take some time to write them out, and everyone. And then talk, and of course, that information, symptoms, other things that might be relevant, going to be important. Family history, be ready to give your family history too. So that's what I wanted to tell you about prediabetes. It's common. You need to know kind of who's at risk for it, and there are people who are at risk. I think every adult, I think kids too, if they're overweight, definitely need to be tested up down to the age of 10 even. And then what do you do to prevent progression? I mean, what is the implication here? Prediabetes goes to diabetes. How do you prevent it? Well, exercise, weight loss, and maybe medicine. So thank you very much for your attention. Here's some very helpful resources here on the slide to refer to if you would like. And thank you very much for your attention.